Introducing Melanie Metz. Melanie, Mel, joined the Commission in March 2025, bringing deep experience of public service across aged care, the NDIS, Social Security, Medicare, the Pharmaceutical Benefits Scheme, and the National Redress Scheme. Prior to joining the Commission, Mel was the Assistant Secretary of the Aged Care Legislative Reform Branch and Department of Health and Aged Care, where she led the development of the Aged Care Act 2024. In addition to policy and delivery roles within government, Mel spent 10 years working as in-house counsel and is admitted as a legal practitioner in the Australian Capital Territory. Her passion is social policy, and social care regulation has been a particular focus in her career.
I'm Mel Metz, the Deputy Commissioner for Sector Capability and Regulatory Strategy at the Aged Care Quality and Safety Commission. Very new in this role, just started last month. Today, I'm going to speak to you about providing a culturally inclusive lens to the strengthened quality standards. And I'll talk about how the strengthened quality standards fit within the broader regulatory rights-based framework and how providers and workers in aged care can ensure that older people's rights are upheld. So the new Aged Care Act, which commences on the 1st of July this year, will introduce a rights-based framework for the delivery of aged care. And this means that the new Act has been designed to put the rights of older people first. Cultural safety, diversity, and inclusion are really important concepts in the new Act. For example, the Statement of Principles states that the aged care system should offer accessible, culturally safe, trauma-aware and healing-informed care to everyone in aged care, and that includes people who are from culturally, ethnically and linguistically diverse backgrounds. The Statement of Rights outlines what older people should expect when seeking or accessing government-funded aged care. This includes things like the right to make their own decisions about their own life, to have their decisions accepted and respected, to get information and support to help them make decisions, to communicate their wishes, needs and preferences, including where they wish to work with their provider to take personal risks, to feel safe and respected, to have their culture and identity respected, and to stay connected with their community. Diversity, inclusion, and principles of high-quality care are embedded in the Statement of Rights. And high-quality care means the delivery of aged care services to a person in a manner that puts them first and upholds their rights. So it includes adopting policy practices and environments to ensure that services are culturally appropriate for the diverse life experiences of older people, incorporating diverse lived experience into the organisation's workforce and decision-making, and making bilingual aged care workers and interpreters available if that's requested by the older person. So aged care providers from 1 July will have to ensure that their actions are consistent with the Statement of Rights, which includes the right to equitable access. So that is for people's needs to be assessed, reassessed and delivered in a manner which supports and values their identity, culture, spirituality and diversity, and that is culturally safe, culturally appropriate, trauma-aware and healing-informed. So the new Act outlines obligations for registered providers and for the aged care workforce. Some of these include registration conditions, the Aged Care Code of Conduct, the strengthened aged care quality standards, and continuous improvement requirements. So these obligations require providers to have and to implement systems, processes and workforce capabilities to uphold the rights of older people so that they receive safe quality care that meets their needs, choices and preferences and respects who they are. So the Commission regulates the rights of older people through these provider obligations. And by ensuring that registered providers are compliant with their obligations, the Commission holds providers to account for delivering care that's consistent with the Statement of Rights. Where the Commission has evidence that a registered provider or a worker has breached an obligation, we will act in a timely, proportionate way to hold that provider or worker to account. So all providers who seek to be registered have to be able to demonstrate how they understand the rights of older people under the Statement of Rights, and they have to demonstrate the practices they have in place to ensure that they take all reasonable and proportionate steps to act compatibly with the Statement of Rights. For providers applying for registration to deliver services in categories 4, 5, or 6, there will be a requirement to have an audit against the strengthened quality standards. And the audit will also form part of the process for renewing registration or adding one of those categories to an existing registration. So for providers operating in these categories, it will also be a condition of registration to comply with these standards in the delivery of services. So the strengthened quality standards. As many of you are probably aware, the strengthened aged care quality standards have been in the public domain for some time. The most recent version was published on the Department of Health and Aged Care's website in February. And there are 7 standards in the new strengthened quality standards. Standard 1, the individual. Standard 2, the organisation. Standard 3, the care and services. Standard 4, the environment. Standard 5, clinical care. Standard 6, food and nutrition. And Standard 7, the residential community. So the strengthened quality standards place a greater focus on the rights and experiences of the older person, which includes supporting, welcoming, and valuing a person's unique identity, background, culture and beliefs, ability, and personal experiences. Each standard places value on respecting and supporting the diverse life experiences of older people receiving care and services. And just noting some statistics from the most recent census in 2021, Australia is incredibly culturally diverse, with just over 1/4 of Australians being born overseas, and over half of Australians either being born overseas themselves or having one or both parents born overseas. So it's very important that the quality standards reflect this, and 4 of the standards in particular call out cultural inclusivity, and I'll go into those in some more detail now. So Standard 1, having knowledge of and respecting an individual's cultural background is crucial to being able to deliver on Standard 1. It has some specific inclusions intended to help guide providers to deliver safe quality care that older people from diverse backgrounds need and expect. This is seen in both the intent and in the outcomes and actions. So on this slide, we show some actions from Standard 1 where the standards have been strengthened to guide providers on safe quality aged care for older people from diverse backgrounds, including Aboriginal and Torres Strait Islander people. So you can see in bold new specific actions for providers to ensure that people's identity, culture and life experiences are upheld and valued. This includes providing information to older people in a way that they understand, which may mean tailoring information for linguistically diverse people. And an important part of person-centred care is that the provider understands and values the older person, including their identity, culture, ability, diversity of beliefs and care experiences. So care services have to be developed with and tailored to the older person, taking into account their needs, goals and preferences. Standard 2 is about the organisation and how the organisation partners with older people in their care. So you can see specific actions that relate to how providers have to do that for older people from culturally and linguistically diverse backgrounds in the design of their care to ensure that care services are culturally safe. Providers also have to ensure that care and services are accessible to and appropriate for people with specific needs and diverse backgrounds. And we also know that our aged care workforce is the cornerstone of great aged care, and we recognise the importance of ensuring that workers have the right skills to deliver care that feels culturally safe. The strengthened standards include a new requirement for competency-based training for aged care workers, including training in culturally safe, trauma-aware and healing-informed care. I would also like to call out standards 6 and 7, which are really important and highly relevant to culturally safe care. Standard 6 is a new standard on food and nutrition, which applies to residential aged care. And it's all about ensuring that meals are enjoyable, that they reflect the preferences of the older person, and that people have a choice about what and when and how they eat and drink. Recognising the really important role that food has in culture and in fostering feelings of inclusion and belonging. Similarly, Standard 7 focuses on residential aged care, and it speaks to how a residential community involves members from different cultures and backgrounds, and particularly that each older person's culture is respected and their diversity is valued, so they feel included, safe, and at home where they live. So to ensure older people are getting the care they deserve from day one of the new Act, we want all providers and workers to understand their obligations under the strengthened quality standards and to feel confident that they can put the standards into practice. And we want older people receiving care and their family and carers to also have a clear grasp of what they can expect from providers, so they know what they can do when their experience of care falls short. We've developed a number of resources to support you as you're getting ready for the strengthened quality standards, and have more in development over the coming months as well. We've published fact sheets and posters for older people about the Statement of Rights, and have a suite of resources available for First Nations providers, workers, and older people. Our resources include some developed in consultation with providers, workers, and older people from CALD backgrounds, and with the advice of our CALD Aged Care Reference Group, of which Nikki and the Centre for Cultural Diversity and Ageing is a member. The digital guidance tool on our website also allows you to provide your service type and role to view or print guidance that's tailored to your circumstances. You can also view the draft evidence mapping framework to see the types of evidence the Commission will be looking for when we assess performance against the standards. We also have workshops, case studies, and activities for providers and workers on the strengthened standards and on culturally inclusive care, and they're available on our Alice online learning platform. So definitely encourage you to visit our website, so you've got access to the latest information and resources. There's a sector readiness plan that you can have a look at, which you can easily find on our homepage, and that details all of the resources that you'll see by month in the lead up to 1 July. And just finally, I'll note that we're always keen for feedback on the materials that we produce. So if there are any gaps, please follow up with us, and we'll see what we can do about putting out more information. Thanks very much.
Now, please join me. We'll introduce Lisa Tribuzio, Manager of Lotus Consulting. Lisa is a social worker who has 25 years' experience in the field of equal opportunity, lobbying to governments to address poverty, social disadvantage, racism and discrimination, and policies which promote oppression of Australian communities. Lisa has worked in the fields of multiculturalism, tertiary disability, and youth and family services, and brings with her experience and knowledge working in community welfare, media, local government, and the education sectors. She has also travelled through Asia and the Middle East working with human rights organisations, promoting cross-cultural exchange, education, and understanding of human rights. She has particular focus on the context of communities and how policies, as well as cultural norms, affect access to services and opportunities. Lisa operates from a humanitarian and community development framework. Welcome, Lisa.
I've been working closely with the Centre, in particular with Nicholas, around the Cultural Care Compass. And I guess today I'm going to be talking about the Cultural Care Compass, and that is a resource that's available on our website, on the Centre's website, for to support aged care providers in adopting a culturally inclusive lens to the strengthened aged care quality standards. So as Mel mentioned, we already know that the standards has diversity, equity, and inclusion embedded throughout the standards. So that's great in terms of the advocacy work that's been done over the years, and that the Commission has responded to all the feedback that's had around the rights of culturally, linguistically, and spiritually diverse seniors in Australia. So this Cultural Care Compass is, I guess, what I mentioned to Mel is that the standards are like the root of the tree, and the Cultural Care Compass is the branches. It's like, how can we support that tree to grow? Cultural Care Compass was developed by the Centre for Cultural Diversity and Ageing recently, just been adopted on our website in the last few months, actually. The aim of the Cultural Care Compass is to support aged care providers to adopt culturally inclusive approaches and practices and strategies, as I know some of you wanted some practical strategies in understanding culturally inclusive approaches, and obviously to meet the needs, goals, and preferences of culturally, linguistically, and spiritually diverse seniors. The Cultural Care Compass is directly linked to the Strengthened Aged Care Quality Standards and complements the diversity approach embedded within them. These 7 standards require all aged care organisations to deliver inclusive and non-discriminatory care and practices. The Cultural Care Compass acknowledges that the Royal Commission into Aged Care Quality and Safety identified 4 areas for improvement, with diversity being integral in all aspects of aged care services. So it has that real human rights element, as Mel mentioned, with the standards. Cultural Care Compass has specific performance measures to support providers to show evidence that their organisation has embedded an inclusive, non-discriminatory approach in its care and service delivery. Each performance measure aligns to the relevant Strengthened Aged Care Quality Standards requirements as set out by the Commission. But providing culturally inclusive, safe and non-discriminatory high-quality care is also a legislative requirement, and watch the space for the new Aged Care Act coming about this year, but also the Racial Discrimination Act and quite a few other legislative requirements to support people in Australia to be safe and to be culturally safe. Also the right to speak in your preferred language as well, the right to communicate. The themes of the Cultural Care Compass may also support providers in preparing to become a cold specialisation, to apply for, cold specialisation verification. And so that's sort of a separate thing. It's emerged in aged care policy development, but of course this can help to sort of become that recognised provider for cold specialisation. The planning tool is under the resources tab on our website, and it's a fillable PDF file. So when you can just go to that file, download it, and you can enter the data within that PDF file. And it is being designed for self-assessment, enabling aged care providers to evaluate your current practices against the performance measures, identify key areas for improvement, and then implement some strategies to achieve inclusive care. And if some of you are not aware, the Centre for Cultural Diversity and Ageing has been known for its inclusive service standards. So they were developed in 2018. And so this is the 3rd iteration of those standards, but we've renamed them Cultural Care Compass. But in the past, of course, it was the Inclusive Service Standards, the 2018 version and the 2023 version, if I'm not mistaken, which was updating the Inclusive Service Standards based on aged care policy changes. So this is now a whole new one based on the new standards. So we're really excited about that. And so this is what it kind of looks like in relation to the performance measures, and then how to measure against those performance measures for your organisation. So it's like done, do it better, did it well, some of the evidence, some of actions for improvement, and then how they align to other standards within the aged care quality standards, because a lot of the standards overlap in what they're talking about. And so this sort of gives you a little bit of a framework in how to think about that. What do we mean by performance indicators? Well, obviously, they're not mandated. They're just guidance performance indicators. They're not going to be assessed by Aged Care Quality and Safety Commission. However, if you were to present this tool in an audit, it'd be very impressive because the the Cultural Care Compass has been reviewed and feedback has been given by the Commission. So there's been a collaborative effort done there, but also reviewed by other providers as well. So we're collaborating with the Commission, so you'll stand out basically. So in Standard 1, which is the person, some of the performance indicators. So there's a lot more than this, but we've just highlighted a few. Things like supporting older people to communicate in their preferred language. How are you doing that? I mean, it's obvious that people from culturally and linguistically diverse backgrounds may have English language barriers. So how are we thinking about that? How are we implementing procedures to report and address incidents of racism? And this has been a very interesting one in the sense of research being emerging from the National Aged Care Research Institute, NARI, in particular around high incidence of racism across with the clients as well as the workforce. And other things like how do you enable older people to celebrate and express cultural and religious activities? And of course, we've got our cultural care plan available on our website to have a look at in the assessment process, how to understand and assess people's what they want in relation to their cultural expression and language expression. As I just mentioned, in the intake and assessment process, how are you measuring that? Standard 2, which is the organisation, looks at things like that all workers are receiving training on culturally appropriate care and it's regular and ongoing. And that includes agency workers and subcontractors. So just to make that clear. How are your marketing materials and lifestyle calendars and menus and client feedback forms? How are they translated or co-translated? Because sometimes you can translate one thing to another, but it's a completely different word. So co-designed and co-translated with the community. How are culturally diverse older people involved in consumer advocacy groups, as well as their feedback is respected and there's culturally inclusive feedback mechanisms and loops? Do you have a language services policy? As well as mentioned before, could you consider becoming a culturally and linguistically diverse specialist provider? So not to overwhelm you, these are just like, remember the leaves that are part of the branch. So, they're not going to be like, have you done that? Have you done this? But it's just based on our 30 years experience in culturally inclusive care at the Centre for Cultural Diversity and Ageing and some of our knowledge that we have around this topic. Standard 3 is care and services. So this is a massive one. I mean, it's such a big topic, isn't it? But we've tried to be a little bit specific, but also complement the strength and age equality standards around adapting the services to meet their needs around end-of-life care. So even though Mel mentioned it's this apology of culturally appropriate care, we've looked at some of the topics that have emerged in our discussions, like end-of-life care, which is linking to spiritual practices, linking to community leaders, linking to rituals and practices that are in line with that person's core beliefs, as well as adapting services to meet the needs when living with dementia. And of course, you might want to look into the dementia field around that culturally appropriate dementia care. Supporting older people with access to diverse entertainment. And we have our practice guide on what was it, Nikki? Culturally inclusive media entertainment within residential care facilities and in home care as well. But you've got an older person in a residential care facility. They have a language other than English, and they're watching TV in their room. Think about it. How can we be creative here? How can we link them to really cool, entertainment and sitcoms and things online? Because not everyone wants to watch SBS News in their language. And it's actually quite negative sometimes. Support for older people affected by global events. This is a really interesting one as well. So it's sort of this thing of when something happens overseas, we need to be aware that there's vulnerabilities that can be had with your client around the relationship that they have to that event and any extra scaffolding in place to support that person's mental health and well-being and social inclusion. And also, when global events happen, there can be an increase in racism and vulnerabilities there for some people based on the research. The next one, the environment. So this is the overall environment. Like, how is the environment safe for the person? How do they feel a sense of belonging? How are they reflected in their environment as well? So this may include things like practicing their faith, like a multi-faith prayer room or a reflection room of some sort, culturally inclusive written signage and visual materials in multiple languages. So we have our communication cards available in over 70 languages on our website, which is aged care signage and communication cards. And where appropriate, talk to culturally diverse older people about the equipment being used and, just sort of having those consultation and feedback loops. In terms of clinical care, this looks at just developing and providing training on an ongoing basis to all workers around culturally inclusive clinical care practices, and that all workers receive training on trauma awareness. And this is obviously now, as Mel mentioned, a new requirement. So trauma-informed care is a new one, healing practices. And so maybe you could ask us later if you wanted to know more about trauma-informed care training. And that includes worker wellbeing. Again, procedures are in place to report and address incidents of racism, as mentioned before, and around sort of the clinical care practices, like do people have a choice of what gender? So, of the worker. And that could probably be embedded in your culturally appropriate care training, but the gender is really important. Some older people have asked for a specific culture of the worker to be matched to, and that's a little bit more nuanced. But in terms of gender, we think that this is a culturally appropriate care practice for gender. If as much as reasonably you can do that, in some cultures, conservative cultures, for example, or however you want to define it, the gender is really important for being safe, extremely important for being safe. And food and nutrition, this is a new one. So this is great because people keep telling us about this. And as Mel mentioned, it's a new standard, but we've just gone things like a deeper dive into it, such as utensils, spices and condiments, things like obviously food requirements, halal, kosher, vegan, Mediterranean diet, fasting, and supporting old people to develop recipes, co-design some recipes, help out in the kitchen, and also to share. So when you're eating, do they want to share with their families and friends? And the residential community, again, it's the larger community. How are they contributing to their community? How are they co-designing the community? Are they involved in lifestyle activities? Are they able to celebrate their religion and spirituality and festivals and cultural days? Do they have access to, visitor schemes where they can talk to people in their own language and be connected to the outside community? So next steps, we encourage you to have a look at the compass, speak out, and obviously reach out to us anytime in order for you to be guided in understanding the compass. If you want us to train you on that compass, let us know as well. Come out to your organisation and continue to working towards making services and practices welcoming, safe and accessible for everyone. I just wanted to mention as well that the images that are in this PowerPoint have been part of our diverse media project that myself and Nikki worked on, where we photographed 10 seniors in the community around a strengths-based visualization and marketing and comms program, where we asked them to say, what gives you joy? Can you, and we co-designed these photos where they wanted us to take a photo of them with the theme of joy, belonging and love. And so these images are really important because they're very local and authentic. And sometimes when we go on Shutterstock and other images, it's sort of like really polished and quite American. So these ones are really local. And this is a senior that we worked with who chose to show a photo of her partner on the wedding day. And she's a widow. So, just wanted to end on that. And thank you very much. And feel free to ask any questions. Thank you.
The first question I have is actually to both of you, Lisa and Mel. And that is, do you think culturally appropriate care is mandatory or is optional?
It's not optional. The way that the new Act has been set up is the Statement of Rights is now in primary legislation, and attached to the Statement of Rights is a registration condition that providers have to show. They have to understand the Statement of Rights, and they have to show how they've got procedures in place to uphold it. For those providers who are subject to the quality standards, there's also a condition of registration around the quality standards. So it's not an option. It's part of what providers have to do. And I know there's a comment in there around there's a lot involved, which I agree with, but there's a lot of detail on the Commission's website, and the Cultural Compass is a great resource for providers to understand what they need to do to meet those requirements.
Thank you, Mel. That's good to know. So everybody, I think, listened or heard that.
Thank you so much for the question, Nikki, because I know that when we sometimes consult with providers, they sort of say, it's not a necessary thing to do. And I guess I wanted to reflect on this idea of social norms in our society. So, we live in an English-speaking country, and, you imagine you don't speak English and you go out to Coles and you're going to buy something from Coles. Imagine the struggle. Just imagine that for one moment. And then let me know if it's a necessary thing to do or a nice thing to do. And on top of that, there's research which, sort of backs up this idea that racism does exist in Australia. Now, whether it's interpersonal racism or structural racism, it does exist. I can give you over 10 to 20 resources now if you want. So if we're going to deny it, then we can. But if we want to be professional leaders in whatever sector it might be, whether it's aged care, community care sector, disability sector, or multicultural sector, we need to follow the research and listen to that research, consult with communities. Now, there's a difference between interpersonal racism where someone says someone did something violent to me, which is happening in aged care facilities at the moment to the staff. We know, and perhaps to the clients as well, but we're looking at research into the staff now because it's a culturally diverse workforce. But then you've got that whole idea of structural racism. And what that means is it's sort of this thing of if we continue the social norms, people are going to be left on the periphery. And that's just not people from culturally and linguistically diverse backgrounds, but people living with a disability, people, perhaps from low socioeconomic areas. We just know. So it's about how do we become mature and professionals in the industries.
Now we have a question from Sarah. That is, could you provide any recommendations for trauma aware and healing informed training for the aged care sector that has already been created?
Well, I can't say that there is something specific on the Alice platform, but definitely go and check out what the Commission has available on Alice for workers and providers.
Yeah, and there's also Phoenix Australia has provides training on that. So if people would like to check out Phoenix Australia, that's another organization who has done a lot of work in that area.
There's a project done by Helping Hand. It's a government-sponsored project, and they have a fantastic 2 modules. The first one is about trauma-informed care, and the second one is sensitive conversations in regards to people who have experienced trauma. I've used those both in my workplace and been received really well.
Thank you, Jen. Also, I remember that we had a webinar previously where we featured STARTS. They're from New South Wales, but they also do training in the area of refugee and trauma-informed care. I have another question. Now we're going back to sort of the question of optional and mandatory. Now, if you were talking about Standard 6 before, Mel, and we were talking about food. So I was wondering if somebody goes into an aged care facility expect a culturally required diet? Let's say you have a requirement for halal or for kosher or Jain vegetarian or whatever it is. Can somebody expect that from a provider?
When someone is entering aged care, there are things that they need to speak to their provider about. There is some training on the food and nutrition requirements on the Alice platform. So definitely suggest people have a look at that. There's also been a menu and mealtime review program. And so there's lots of resources available to providers to ensure that they're meeting that new standard around food and nutrition.
I understand you can actually make a complaint if your diet requirement isn't met. That's how I understood it.
Yeah, I think food is probably one of the things most complained about in aged care. So people can contact the Commission if they have issues with the food that they're being provided with, and we'll help them through the process of getting a resolution.
We have another question from Orchidia. So Orchidia is asking, for question for Mel, how are organizations going to meet all these needs when the main role, which has always been focused on and has been trained on this cultural area in aged care, have been lifestyle stuff, which have decreased. So what she's basically saying, how is it possible to do all these requirements to fulfill, things like culture appropriate care or other activities if lifestyle staff have been cut?
It's not just a responsibility of lifestyle staff. So the new worker standard requires all workers to be trained in cultural competency. So it isn't just the responsibility of lifestyle staff or a particular worker. It's the responsibility also of the provider and the governing body to make sure that those culturally safe and inclusive practices are embedded within the organisation.
I guess I would like to ask you, Mel, where do you see, providers' most challenges or most difficulties in implementing inclusive practice? Where do you think there's room for improvement?
That's a really good question, Nikki. I think it depends on the provider. Some are really already very good at this, and so it's not going to be a challenge for them to meet these requirements at all. For other providers who are sort of entering or being required to meet the quality standards as a new requirement, it is probably more of a challenge for those providers. So one thing that we've been really careful to try and do is to make sure that we've got resources available for all different provider types. So you can go to the Commission's website and tailor the resources to the type of provider that you are. So yeah, it's a good question. I think Lisa, you might have something to add to that, and in your experience working with providers about things that they might find challenging.
It can feel very overwhelming for providers in the change management process, and especially really large concepts like culturally inclusive care. It's a big topic, and I think that's why we developed we were sent to develop the diversity mentoring program, which is sort of like a hand-holding program to guide providers around the change process and culturally inclusive practices. And I feel like a lot more resources are needed in this space to help providers with adopting culturally inclusive practices. Some of them have been doing it for years, and they could also have that peer support, offer that support to other providers. And then some of them that are new in this space need that support, like you mentioned. And I think Kath from the Centre for Cultural Diversity is also working with regional providers, and there's new and emerging themes coming from those providers as well. And in some residential care facilities, I'm just talking about residential care facilities, there's only one or two people that have English as an additional language in the facility, rather than it being like a whole multicultural space in some other providers. It also depends on the client population and the diversity of the clients in your space. So by collecting that data first, you're able to then know how to respond to it. So it is quite complex, and I think that's why the Cultural Care Compass is sort of a guidance tool for providers, and we often say, don't feel scared. There's people there that can help you, like the PCAC Alliance as well.
So Lisa, do you like to go first? Any final comments you have?
I just wanted to acknowledge the Commission's efforts in embedding diversity, equity, inclusion across all of its standards, and introducing the food and nutrition one as well. It is certainly related to culturally and linguistically diverse clients and seniors in accessing aged care. So I just wanted to it's really exciting times, and acknowledge the sort of the wins as well. So yeah, and also all the efforts made in people coming to this webinar too, because it's such an important topic. So thank you.
Well,
yeah, thanks, Nikki. I think what I'll say is for any people who are worried about the new quality standards and how they might meet them, definitely go on our website and have a look at the draft evidence mapping framework, because that will give you a sense of when an audit is done, what the auditors will be looking for. And that will give you a good steer about what kinds of things you need to do to get ready for the new standards.
Thank you, Lisa. Thank you, Mel. I really appreciate you being on the call today, and I'm sure there will be more to come from you, because it's an important space, as we all know. If there's any questions, please don't hesitate to contact us at info@culturaldiversity.com.au, and otherwise we'll see you at our next webinar. Thank you very much.